allied health professionals at Peter Mac? No? Okay, good. So it's all pretty new. So what I'm going to do first to prevent myself talking all the time and Uyen is we've got a little 5-minute video clip about allied health at Peter Mac that we thought we would play for you first. So I'll just hopefully IT systems work and this will work. So let's see. Or maybe not. I have to press it on this one, sorry.
Is there meant to be audio in this, Belinda?
Yeah, can you hear the audio bell?
You can't hear it?
No.
Is there a button when you shared your screen to check that said also share audio? I'm not sure.
It might be that. So I will stop sharing for a minute. It might be that if I share the other screen, I've sort of got too many screens going on. Let me just try again, sorry. You hear that?
No.
Right. Of course, IT won't work for us, so that's okay. We will skip over that. We cover most of it anyway. But if anyone is very interested, let us know and we can send it around. Sorry about that. All right, so in terms of the role of allied health in cancer care, as I'm sure you're all aware, cancer itself, as well as its treatments, impact a person with cancer's life in very many different ways. So obviously the cancer itself can have a huge effect, particularly certain cancers, on how we function, as well as how we feel, how we socialise and interact in so many different ways. And then we add on top of that the treatments and all the side effects that can have. And as you're probably well aware, I've listed here the common treatments that patients with cancer will have, and many people will have a combination of these. Some people will have only one. But if we think about surgery first, it is usually combined with chemotherapy or radiotherapy or both. But sometimes surgery on its own is all that you need to remove that cancer. It can have a huge impact on you at the time of surgery and the recovery from surgery in the short term, but also in the longer term. And allied health plays a really big role in surgery preparation as well as surgery recovery, and we will talk about that a bit today. We've got chemotherapy, so that's the use of cytotoxic drugs that are usually given intravenously, although these days we're moving towards a few more oral chemotherapies, so in the tablet form, which is great. And these kill off the cancer cells and slow down growth. And chemotherapy is used in all settings, so it can be used as part of a treatment to try and cure the cancer, and very commonly it's used in the sort of more palliative setting where we're trying to minimise and slow the growth of the cancer and prolong life. Chemotherapy is very well known for its side effects, so things like nausea and vomiting and loss of appetite, fatigue, hair loss, etc. And again, allied health plays a really key role in helping manage and treat some of these side effects and trying to make life feel a little bit normal, if you like, for people that are undergoing that. Radiotherapy is again another very common treatment that's used in cancer, and that's the use of high energy particles to stop the cell division and cell repair. It's very commonly used in combination with chemotherapy, but can be used on its own. And when it's used with chemotherapy, the idea is that the chemotherapy makes the radiotherapy work even better. But in that situation, the side effects that you get from those two treatments combined together are more severe as well. And again, allied health has a very key role to play in helping manage the side effects of radiotherapy, particularly things like the fatigue, the sore mouth that people get and the swallowing difficulties that they have, etc. And we'll talk a bit more about that. I guess the more newer treatments that are around these days, so including immunotherapy, where we use patients' own immune system to help fight the cancer. These therapies tend to have less severe side effects, I find. So I'm a dietitian by background, so particularly from a nutrition point of view, immunotherapy has less severe side effects than our more traditional treatments of chemotherapy and radiotherapy. But in saying that, when there is side effects, they tend to be very nasty, and they can have a really significant effect on a patient and how they're feeling and how they're coping in day-to-day life. And then stem cell transplant, which is a very specific treatment used with hematological or blood cancers, where we take stem cells from a patient, grow them up and then put them back in again to try and remove the blood cancer from the patient. And this has significant side effects for a patient, means they're in hospital for quite a period of time. And go through all different types of side effects and feelings over that time, where they need a lot of allied health input as an inpatient, but also as an outpatient when they get home and are in that recovery phase. So we'll talk about this a bit more, but just to give you context, I guess, of the main treatments that happen and where allied health can perhaps fit into that. So I always like to think of cancer treatment as needing a team of health professionals to help you feel the best that you can. So yes, your oncologist is a very key person in that team, and without them you can't get the treatment that you need. And it might be that you're seeing many oncologists, a medical oncologist for your chemotherapy, a radiation oncologist for your radiation therapy. You might be seeing a surgeon. So there's not just one oncologist or doctor that's part of your team. You may have many, but a team doesn't just mean the doctors, and allied health and nurses are very big on making sure that that team is much broader than just the medical team, because they can treat your cancer, but in terms of managing the side effects of the cancer and the treatment itself, you need more than the doctors to get that really holistic vision and care. So allied health are a really key part of that, where we can help address that holistic vision and make sure that you can keep doing the things that are important to you, that you can keep going for your walk, it might be, that you can keep having that meal with your family that's really important to you, that you can continue to communicate well, that you can continue to do your job if you're someone who still works. So all those things are key areas that allied health work with. And the key thing about oncology allied health clinicians is that we really understand your experience and what you're going through. So allied health can work in many varied different places, but the people that work at Peter Mac particularly are oncologist specialists. Obviously, we work with oncology patients every day, and we tend to work more so in tumour streams. So we really get a great understanding of your cancer and what you're going through and how we can best help you get through that. Every person is different and everyone will have a different experience, but we try to use all the knowledge and experiences that we gain in our role to help make your experience as good as it possibly can be, and make that patient journey the best that it can be. And that's something that I have always been very, very passionate about as a clinician, and try and instill in all my team, that's for sure, that we're here to help you to make this as easy as it can be, because sometimes it is not, as I'm sure you're aware. So in terms of who is allied health at Peter Mac, and it's varied at every hospital that you go to as to what allied health means. But at Peter Mac, these are the key professions that we fit under that umbrella, if you like. So there's speech pathology, nutrition and dietetics, physiotherapy, exercise physiology, occupational therapy, and spiritual care, or what used to be known as pastoral care, but now known as spiritual care. So we'll go through each of these professions and give you a little bit of a rundown about who we are and what we do and how we help people. So speech pathology first. So I manage this very dedicated and busy team of 5 very passionate speech pathologists. Unfortunately, our photo only has 3, but we have recently grown by 2, which is a really lovely and exciting part of our team. Our speech pathology team works 5 days of the week, so our Monday to Friday service, and we work here at Parkville, but we also have 2 speech pathologists that work out at our Moorabbin campus, not full time, but they're out there 4 days of the week, so seeing our patients that are having radiotherapy at Moorabbin. So that's part of my team, if you like, that work from here. The speech pathologists see patients in both specialist clinics and on the wards. Cancers here at Peter Mac. They can see people with any cancer diagnosis, but predominantly their work is targeted at those with head and neck cancer, which I'm sure will make sense to you when you think about the cancer itself and where it's located, and the treatments and the effect that it has. Then it's a massive impact on a patient's ability to swallow and communicate. So when I asked one of my speech pathologists, what are the key messages I should be telling you about what a speech pathologist does? the first thing she said to me was, please tell them that despite our name being speech pathology, that's not all that we do. We don't just work with speech. And actually a majority of the work at Peter Mac is actually with swallowing. So again, if we come back to the fact that they mostly work with patients that have head and neck cancer, the cancer itself and the treatment can have a really drastic effect on a patient's ability to swallow safely food and drinks. So our speech pathologists are always working with patients to assess their swallow and to make it as safe as possible. But they do also work with communication and speech difficulties, and they can see patients at any point. So it might be at diagnosis that they are already having problems and they're seen throughout their treatment, but also after treatment for some time they can be involved with patients. In terms of assessing their swallow, they can use some really special swallowing assessments. So you might have heard of a thing called a video fluoroscopy, which is where they do a swallow assessment under X-ray. They get the patient to eat some food that has some special X-ray sensitive material in it, and they watch what happens with that food and where it goes, or fluids, and they can check that it's going down the right way, if you want some really easy terminology, rather than into our lungs. They can also use another type of swallow assessment called a FEES, which is a fibre optic endoscopic evaluation of swallowing. It's lots of big words, but essentially it's where they're putting a very small camera down your nose and looking down into your throat, and they get you again to eat and drink things, and they can actually see your swallow working through that camera, and that gives them a really good insight into how the swallow is working and what's not working well. And then they can go on to provide strategies to make sure that the way and what you're eating and drinking is as safe as possible. So sometimes that means some modifications to the foods and fluids that people are eating. So it might be that they need to have their food minced up or mashed up or perhaps pureed to make it safe to swallow. It might be that their fluids need to be thickened up and that they can't drink just straight tea and coffee and water, and that they need that a little bit thicker. Or it might just be some simple strategies like tucking their chin down or turning their head a certain way can be enough to make that swallow safe. And that's some of the really specialist work that our speech pathologists do to try and maintain normality for patients as much as possible. Along with the swallow work, they do provide assessment and education for effective communication. And I think until you lose the ability to communicate effectively, I don't think we appreciate how important that is to our day-to-day life, and particularly when you're going through cancer treatment, being able to clearly communicate your needs and wants and problems is essential. So they work very closely with patients and their family and carers to get effective communication strategies in place where that is a problem, and make sure that people can still communicate their needs and wants and desires throughout that time. And our speech pathologists work very closely with the dietitians, but they do work very closely with everyone. They work very closely with our physiotherapists, particularly in an inpatient setting. But the dietitian and speech pathology relationship is key, particularly when we talk about modifying textures of foods and fluids. They tell us what they need, and then the dietitians come along and talk about what does that actually mean in terms of foods and how do you achieve that sort of texture that they need. So a really close-knit team in terms of speech pathology and nutrition, but I would say, and we can say this across our whole presentation, that I think Allied Health at Peter Mac works very closely together as a very much big, broader team, and make sure that we support each other and get the best for our patients. So next, to cover off on nutrition and dietetics. So again, a really dedicated team, but a much bigger team, and this picture only represents a portion of our dietetic team. So we have 15 dietitians that work at Peter Mac, and we also have 3 allied health assistants that are part of our team. They standardly get called nutrition assistants, but I should mention that they do actually work with our speech pathologists as well. So they don't just work with the dietitians, they work across both those teams. The dietitians provide a 7-day-a-week service, so we work on site Monday to Friday, and we have an on-call service on the weekends and on public holidays. And again, a majority of our team is placed here at Parkville, but we also have a full-time dietitian out at our Moorabbin campus, and we also have a dietitian that goes out to our Box Hill radiotherapy campus once a week as well. So we see patients across all the Peter Mac serviced campuses, if you like, and provide a service across all those. We see patients in both specialist clinics and on the wards, and it's a pretty half split. So we have a lot of our dietitian EFTs placed up on the wards, but also we see a lot of patients in outpatient clinics as well. And dietetics works with people across all cancer types. We do tend to have a bigger service in areas such as head and neck, upper gastrointestinal, so things like gastric and esophageal cancer, as well as lower gastrointestinal cancers in the haematology units, so the blood cancers, and also the lung cancers are probably the key units that we work mostly with, but we do see people with any type of cancer at any time point. So the key thing that our dietitians and our allied health assistants do as well is we really work hard at assisting to improve and optimise a patient's nutrition at any time point. So again, we can see patients at diagnosis prior to starting treatment to try and either prevent them from deteriorating or trying to improve their nutrition if it's already at a point that's not ideal. We will see patients throughout their treatment and after their treatment as well, trying to get them to improve their nutrition back to where it should be following treatment. Our department historically has had a really high focus on cancer malnutrition, and malnutrition can mean over and undernutrition, but when we're talking about cancer malnutrition, it's definitely a focus on undernutrition. It's something that's very prevalent in our cancer patients, and we know that it can lead to some really poor outcomes for patients. So we've worked really hard and run many projects over the years at focusing on preventing cancer malnutrition from occurring in the first place, diagnosing it as quickly as we can when it is present, and then treating it so that we can make someone well nourished again, which is going to lead to much better outcomes for them. But in saying that, we also work in the what's called the survivorship space, if you like, so that post-cancer treatment to try and help people to be as well as they can be. And that's a very different focus to when we're looking at and talking about cancer malnutrition, when it tends to be undernutrition. When we're working in the survivorship and the well-being area, it is more focusing on really healthy eating, healthy lifestyle to prevent further cancer occurrences and to keep someone healthy and well. So they are quite different. And I know, again, as working as a dietitian, when you introduce yourself to someone for the first time and say you're a dietitian, and not to be sexist, but particularly men used to groan a lot because they would think that, oh, he's a dietitian to come and tell me to stop eating all the good food and tell me just to eat, you know, lettuce and carrots and things. And I always took great pleasure in saying, actually, in a cancer hospital, the reason I love my job is because that's not what I'm talking about. It's not about all the super healthy, low calorie, low fat foods. It's almost the opposite for some patients at some points during their cancer journey. But when we do move to that post, and if someone's fortunate enough to be sort of cleared of their cancer, if you like, then we do start to move back to that a bit more healthy eating, and we become less popular. But there is a bit of a misconception, I think, around dietetics and what it means to the general public versus what it means for a cancer patient. Some of the specialist work that we do in nutrition and dietetics is around providing education and support for patients that require tube feeding. So you may have seen patients with tubes that are down their noses, and those such as this patient in this picture where it's hidden under their shirt going directly into their stomach. So our dietitians educate the patients on how to use those tubes and look after them and what they need to put down them, and then we support them in the community. They do their feeding at home usually, and we're their kind of go-to person when they run into problems. We provide all their supplies, etc. And then when the time comes, which for many patients it does, we facilitate the removal of those tubes as well. And we're very fortunate to have some highly skilled dietitians in our team that can actually remove the tubes themselves. So it's a really nice service where we don't need to get a whole lot of people involved, and it's something that we can manage quite well within our team. So that's some of the specialist work that our dietitians do here. And we work very closely with speech pathologists, as we said, but we also work very closely with our food services team here at Parkville, where we're feeding our patients that are on the wards. We have a dietitian that works in the food services department and makes sure that the food that we're providing is the best food, the tastiest food, trying to move away from that, again, conception of hospital food being horrible. The feedback around Peter Mac food is very rarely that, which is good, although sometimes that does come through, but also making sure that it's really nutritious and the right type of food for our patients. So again, we work with everyone, but they're probably some of the key teams that our dietitians work with. I'm going to hand it over to Uyen now to talk about some of the other teams.
Thanks, Bel. Bel, could I ask you to forward the slide if you've got control?
Yep.
So Yep, thank you. So my background is from physiotherapy, and I've been at Peter Mac the last 9 months, and I actually don't come from a oncology or cancer background, and that's been really enlightening. And just to echo what Belle is saying, my impression here at Peter Mac is, firstly, there's so many dedicated staff, carers, patients just love Peter Mac, majority of them, and there's such good reason. And coming from allied health, we know that we work closely, but at Peter Mac, everyone do work so closely, and everyone does really put patient care at the forefront of what they do, which is fantastic. So physiotherapy is one of the larger allied health profession. There are 9 physiotherapists here. And along that, we've got 2 exercise physiologists and 3 allied health assistants. So we tend to do everything across the spectrum from very early on in cancer care all the way through to the wellbeing. And we see patients on the wards or in the specialist clinics as well. Sometimes we're not always that popular. And so when you've had surgery and all you just want to do is rest, day one, young, chirpy, energetic physio say, okay, let's go. We're going to get you up and moving. And that's the last thing that you want to do. But that's really the first thing that you really need. And so we definitely are patient-centered. We always work with the patient, but sometimes we do things that are really important, but that's not always pleasant. We do the pleasant things as well. In allied health, we always work with the patient. We set goals. We try to match our expectations with your expectation. And as carers, you're really an important part of that, because the patient is what they're going through, the family's going through the same thing, and the stronger the support that the patient have, the better they'll do. So it's really important that we work with the patient, and we work with the carers, and we work with the family. So we do provide a 7-day-a-week service, and we see all patients at different cancer types. We also come out to Moorabbin 1 day a week to see patients who are undergoing radiotherapy as well. Next slide, please, Bill. Thank you. So physiotherapists and exercise physiologists address functional decline before, during, and after. And so before treatment, we focus on improving fitness before your prolonged or risky treatment. And so there are, with cancer, it is serious, and there are serious treatments which have really good effects, but there are also risks associated with that. And we know that patients who undergo major surgery have a high risk of possible complications. What we also know is that the stronger, the fitter, the healthier the patient is before they have that, the better they do. Okay, and so there's now a saying, exercise is medicine. And so getting patients stronger, getting them mentally, physically, holistically prepared, the higher you are, you will take a hit when you have that procedure, but the higher you are at the start, the quicker, easier, faster you bounce back, and you're in a better position. So there's a lot of focus on before the treatment, as well as obviously during the treatment. So our focus is on getting you to recover as quickly as you can and getting back to normal function. And then after treatment, to once you've had the treatment, guiding you and supporting you in the recovery process and focusing on self-management. So one of my observations, not coming from an oncology background, is that whilst all allied health clinicians are university trained, so we all have this basic knowledge, but cancer is different. And so there's not a lot of cancer allied health therapists. And so at Peter Mac, it's a unique workplace where everyone's there, have that knowledge and dedicated. But also we need to use that resource to really support our patient where they need it. And so we do link a lot of that with our community, and we educate and work with our community so that they're supporting patients in the community as well. But we also, if the patient's issues are not necessarily cancer related, then we try to refer and link the patients, etc., to more of the community services, so then we can provide that more oncology or cancer type of treatment. Next slide, please, Bill. So the key for us is maintaining independence and improving physical functioning as best as we can. And so sometimes, though, recovery is delayed, or recovery in cancer sometimes is not always possible. So in that, we do target specific problem areas, and we work with patients along with that. So we do assist with symptom management. So that could be pain, or that could be fatigue. And so we firstly work with the team to work out how, as a team, we can better manage our patients with medication or with symptom management. And then we also talk about education and strategies and providing resources on how the patients and the carer can manage that as well. And we also advise a lot of strategies for long-term management and long-term changes. Because again, our patients are living longer and longer, and for us, I think it's really, there's a lot of talk in health about not just moving from illness into non-illness, but illness all the way through to health and well-being, and that is still a very important aim, whether you have cancer or not. Next, please, Bill.
Did it work?
Sorry, Bill. That didn't. Okay, right. So the type of things that physiotherapy do, and why I'm listing all this, is that as carers, if you know what we can offer, then that's a good way that then you can be aware of what may be available for patients. So we provide exercises, and there's lots of good research to show exercises is very important. And it's not just a matter of giving patients or their carers a sheet of exercise or a print off from the internet, because anyone can do that. But what we know is having the exercises is one thing, but actually doing it is another, doing it safely, wanting to do it, knowing how to do it, and if you're doing it and it's not correct, how do we make it specific to the patient? So providing the exercise involves a lot of working with the patient and their carers and their circumstances, working out, are you ready to exercise? Are you wanting to exercise? And if you're not, how can we encourage you to be ready so that you undertake this treatment, which we know is effective, but how do we work with you for that? So exercises can be strengthening exercise, and we know that the research shows every one of us, myself included, and everyone here, whether you have cancer or not, could be and should be doing more exercise. So, but again, knowing is one thing, but doing it is another thing. So we're really working with our patients and their carers to really encourage exercises and continuing on for as long as possible. So that could be strengthening, stretching exercises, and cardiovascular or aerobic exercise. And I think with COVID and lockdown, everyone's really now got time to really focus on exercise, and that 1 hour a day is so important now. And I think hopefully the one positive to come out of this is we're all exercising and enjoying the outdoor space more, which is so important. We also assess patients if they have balance problems or walking problems. We can provide gait aids. We can provide training to them. We also get patients out of bed quite early to prevent chest complication. As a manager, I get a lot of complaints. Sometimes, well, actually not a lot, but I get the complaints. And it is often because we get patients moving and a bit too quickly according to the patient. And I guess that's a reflection on what we can do better is we really need to educate our patients and really get them on side as to why we may be doing these things that are important to them, but that it's not always that comfortable. So that's really important. We do provide cardiorespiratory care or chest physiotherapy, and that's to make sure with any procedure that you have, you don't get chest complications like a chest infection or pneumonia, which can be quite common. So that's very important. And then we also manage functional decline. So with the disease itself or the complication of the disease, you can have decline. So our job is to really reduce that as much as we can. Next, please, Bill. Beautiful, thank you. With lymphedema, so lymphedema is where you have swelling of the limbs, normally upper limb or lower limb, but you can also have that in the midline, so the neck and the back, etc. as well. And for us, we do have a small but specialised service there where we assess patients. And if we can identify it early, then the management of lymphedema is more successful. So we're providing screening and education and management of that. We also, like I said, provide advice on chronic cancer-related conditions like pain and fatigue. Our new palliative care unit was just opened yesterday, and so we are heavily involved in end-of-life support as well, with discharge planning, to making sure patients are safe to get home, but not only safe, have meaningful quality when they get home as well, independence as much as they can, dignity and function and quality. So we often involve in family education and training and teaching of how to manage symptoms. We talk and liaise very closely with external support to ensure that if patients need ongoing care, that they are linked into services that's most fitting of their needs. And so that includes community services, that maybe include nursing in the community, that may include other private allied health or other things to make sure that patients are well looked after at home. There is a small component of continence and sexual well-being that is a specialised area, but we do offer some support with that. And of course, we offer group exercises, which was face-to-face, but we've moved with the times and with some of the restrictions of COVID, we've now moved to virtual exercises where, like we're doing now, we can encourage patients to exercise in the safety of their home. We monitor their symptoms, we offer encouragement, we check on how they're doing, and we ask how they're going to troubleshoot and ensuring that our patients exercise as much as they can. Next, please, Bill. So exercise physiologist is a small component. It's a little bit similar to physiotherapy, where they are involved in exercises, especially in the before the treatment. And a lot of their what they do is exercise based, and again a lot of group activities as well, either face to face or virtually. We also, like all allied health, we liaise, so we work very closely with people in the community so that we tee in up services for our patients to make sure that they continue to get the treatment that they need. Next, please, Bill. Occupational therapy. It's a bit smaller team of 8 occupational therapists. It's mainly a 5-day service, Monday to Friday. And we see patients mainly on the ward, but also in the specialist clinic. And we also do home visits. So home visits is to make sure that patients who do go home from hospital with long-term changes, they're safely. They may need changes in their household so that they can. So we most of the time we can just talk with our patients and the carers to work out what they need, and we can provide special equipment that they just take home on their discharge home. But for some patients, they actually need their home modified. So that's when we would go home with the patient or carer, look at the bathroom setup. They may need some rails in the bathroom. They may need some rails at the front door. So we work with them to then recommend what changes to the house needs to be done so that the patient is safe, independent as much as they can. And the occupational therapists work with all cancer types. Next, please, Bill. Thank you. So occupation means task that we want to or need to or expected to do in our day-to-day. And so things like showering and dressing, a lot of us don't even think about it. We just do it. But when you've had cancer or when you've had treatment, dressing and showering can be the most tiring thing of your day. Yet, you know, you do that and you've still got the whole day to go. And so when you're really tired with fatigue, or when you're in pain, or when you've just had your treatment, showering and dressing and knowing how to do that correctly or do that in the best way is really important. That's also a lot of that is patient dignity as well. You know, going to the bathroom, if you can do that by yourself or with minimal help, that's really important to someone's dignity, being able to do that. So occupational therapists help with that. We also look at domestic duties, cooking and cleaning, and community activities like shopping, working, returning to work, and participating in recreational activity. So we have patients who are very young that go back to work, and we have patients that are very old that go back to work. And so that's very important to work with our patients and their carers to work out what's important for them. Next, please, Bill. So, yep, we work with patients, family, and treating team to identify the issues. And as a result, you know, there may be shortness of breath, fatigue, pain or discomfort, or weakness or change in sensation. Also, a lot of patients may also have altered thinking, so memory loss or concentration or ability to plan tasks. So our occupational therapists also work with them to assess, work out, and then also help manage that. As well as there can be changes in vision, which if you can't see properly, that's going to affect your ability to do things during the day. Thanks, Bill. So there are a lot of side effects that may affect your ability. So we've mentioned this, dressing, showering, just bending down and reaching, comfortably managing tasks. So we talk about how we can do things in a more energy efficient way, how to conserve energy, but also how to build up energy so you've got more capacity to do things. We also provide equipment to make things safe at home and comfortable, especially with bedding and chair and seating. And also we may be able to advise on driving and return to driving as well. Next, please, Bill. So, yep, it's probably covered there, but the last thing I want to say would be we do have a Let's Talk Fatigue presentation. That used to run face-to-face, but it's moved now to the virtual platform. And we've had a lot of keen interest in that, which is fantastic. So I recommend, if you are interested in that, please look for it. Esther, you run that through here, is that right?
Yeah, we do. And actually the next session is tomorrow, so I will send through some information to everyone if you wanted to join. Yeah.
Great. Thank you. And next, please, Belle. So we move on to spiritual care. This is David Dawes is our spiritual care head of department, and he provided this slide. So I'll just talk through it on his behalf, but just to say that I am not from a spiritual care background. All people connected with Peter Mac deal with human struggles, and this is true for those living with cancer. And spiritual care draws on respect, trust, and understanding. And having worked with spiritual care for the first time in the last 9 months, those words are very true. They are very professional, respectful clinicians who really do look after the interests of patients and carers as a whole. So spiritual care is a way for patients, families and friends and staff to reflect on and explore life. And it can add to spiritual and emotional health and well-being. So they work very closely with patients, families and friends to support them. And you would think spiritual care are all serious, but they're actually some of the most fun, funny, life-affirming people, but also very serious when it needs to be. And I guess that kind of work really does bring everything in life to the forefront. So spiritual care team members on hand to provide support. And it says their specific need or simply someone to stay, listen or talk to, and that's very true. They're there for the patient and the carers for as much or as little as you need. And they're available 24 hours a day throughout the hospital as well. So there's a reflection space which is found on the ground floor. It's open at all times and it can be used for reflection, meditation or simply a quiet space. And it is a really nice place to be when you want to collect your thoughts. Next to the reflection space are the prayer rooms with prayer mats and religious books available for use as well. Thanks, Bel. So, a team approach. Bel, did you?
Yep, I'll go through this one if you like. So just our last couple of slides. So really just wanted to emphasise, I guess, what I touched on at the start and what Uyen has touched on, that allied health really does take a team approach. And our sort of saying, if you like, that's attached to allied health is that we're a vital part of a treating team. And I think that's, you know, how we see ourselves is we're not an add-on, we're not a little extra bit that you get if you want it. We really are a vital part to the team. And to sort of make that really clear is that we do work in all the clinics that we work in an outpatient setting are multidisciplinary, but particularly we have some really key clinics that are multidisciplinary. So our optimization clinic looks at having the physiotherapy, the dietitians and the psychologists and occupational therapy, I think, all together in a clinic, seeing patients often together so that the patient's not having to go through different clinicians, so repeat their story. They come together after the clinic and develop up some key goals for that patient and follow them up together as a team. So it's where we work together side by side with each other to get the best outcomes for our patients. Our prehab program is a relatively new program that we have here. That's a very evidence-based program. And again, Uyen's touched on this, but it's about capturing our high-risk patients prior to their surgery or prior to their stem cell transplant. For the hematological patients, they get to see the physiotherapist, and if needed, they will get referred to the dietitian and the psychologist to get all the right support that they need to get them as good as they can be prior to their surgery so that their recovery is as quick as possible out the other end. And there's some really great outcomes being seen with that program, and the patients really enjoy that, again, that kind of multidisciplinary approach where everyone works together and that they feel like they're actually making a difference to what their outcome themselves are actually impacting on that. And another clinic is our PEG clinic. So that's one of the feeding tubes. And I alluded to that a little bit when I was talking about the dietitian. So that's where the doctors, the dietitians and some of the nurses work really closely. Again, they'll see patients together rather than one at a time, as in the health professionals in the room together, not all the patients in the room together. And we work together to make sure that the right person's doing the right job and the patient's not having to repeat their story all the time, and they're not having to see everyone if that's the case. So some examples of where we work really well as a team to facilitate the best patient care that we can and the best patient outcomes. Allied health also tends to work in a really multidisciplinary functionality when we're talking about research. So a lot of the research projects that are conducted here at Peter Mac tend to be across a number of the allied health disciplines. We do run some of our own sole discipline research, but quite often it is where we've got 2 or 3 of the disciplines coming together to do a research project that's all about improving the outcomes for our patients. And another big part of the work that we do here is around education. And again, we tend to do that as an allied health team. So whether that's educating our upcoming allied health professionals, so the university students, I know in dietetics and speech pathology, we run days of lecture blocks for students, and we tend to bring in our other allied health professionals to talk about how they work in oncology and how we work together as a team so that these students come out as allied health professionals expecting to work with other allied health professionals and not as a silo. But we also educate our colleagues, and again, Uyen alluded to this with community, but also our regional colleagues. We present quite often to regional colleagues around best practice in cancer care and upskilling them to manage their patients that they see with cancer as best they can. And we learn from them as well. And I must say, you know, as much as we see cancer patients all the time, we're always learning from each other and everyone, and we're not necessarily the experts. I know I've delivered education in regional areas and learnt different ways of how to approach cancer care that I haven't necessarily thought about myself. So it's a two-way process, if you like. So finally, in terms of referral process, it's really simple. It's a one-liner. If you or you know of someone who is being treated at Peter Mac and wants to see any of the allied health professionals, all they need to do is ask their treating team to make a referral. So ideally, it's probably one of their doctors, but it also could be their nurse coordinator or one of the nurses that they see on the wards. It's as simple as just requesting to see the physiotherapist, for example. They'll put that referral through and one of the physiotherapists would be in touch with you. So it's hopefully a very straightforward and easy process. So just in closing, to come back to what I said before, allied health is a vital part of your treating team or a treating team. That's how we see ourselves and that's how we want everybody to see us as well. So please advocate for us wherever you can, but also just remember that there's a lot that we can help you with. And to be honest, as much as we've covered off a lot today, there's probably a whole lot more that we can do for people as well. So the options are endless. And I think I will stop there, as we'll win, and I'll stop sharing my screen so we can see your lovely faces.